Good evening, Fiona. Good evening, panel. Was a policy and decision regarding the emptying of hospital beds, with the patients not being tested, and the outrageous consequences on our elderly citizens, a planned arrangement? And if so, does this not highlight the lack of value and respect that we place in the elderly?
So was it a planned arrangement, allowing people back into care homes without being tested? And does it highlight the lack of value and respect? Yes. Alex Massie?
Well, the care homes situation, I think, is one of those areas where governments in all parts of the United Kingdom faced a terrible set of choices. You know, that in hindsight, as Nicola Sturgeon said this week, they would probably make some decisions differently. You know, at the time when people were released from hospital into care homes, it was because they feared that the NHS and the hospitals were going to be overwhelmed with COVID cases. And so, you know, what do we do with people who are, you know, delayed discharge, bed blocking, whatever? You know, well, get them out, almost regardless of their circumstance. And that now, because the sort of tsunami of COVID cases didn't quite materialise, that now looks to be a terrible mistake. And obviously, with hindsight, it was a mistake. But at the time it was made, I think it's reasonable for politicians to say, well, but this was the choice that we had available to us. But you can only do that, I think. You can only get the public to trust you if you communicate with candour, if you allow that mistakes will be made in a you know, fiercely complicated and unprecedented set of situations. But you can't just allow that mistakes will be made. You have to actually sort of admit to them and take ownership of them as well. If you treat people like adults, there is a chance that they will understand the position you're coming from. But you can't just sort of deny that any mistakes took place. And it seems to me to be infantilizing the governments of government ministers wherever they happen to be, to try and pretend that that could be the case. You know, people understand that this is a really, really difficult situation to manage, and that's why, even though patients may be beginning to wear thin, I think there is still a residual degree of goodwill for government if government can be shown to be responsive to the situation, can show that it is accepting and taking ownership of mistakes, and the care home situation is clearly one of them. But you can't go around prattling on about how you've thrown a protective ring around care homes at the same time as thousands and thousands of people are dying in care homes. And the final point of the question there, it is clear, I think, that for a long, long time care homes have been a sort of overlooked, too often forgotten part of the whole health and social care network, and that sometimes perhaps seen as a convenient place to park people whose presence elsewhere might be deemed undesirable or too complicated.
Let's hear from Elaine in the audience. You've had your hand up for a short while now.
Hi, Fiona. I agree with Alex there. I think at the start of this pandemic it was a tsunami and no one really knew what they were doing. And I think the choice, when we saw those horrific images from the Italian hospitals of patients lying out in corridors, couldn't catch a breath, I think the right decision was made at the time to make sure our hospitals were clear, that we wouldn't have those images in the front of our newspapers. And I think Nicola Sturgeon has looked back, like Alex said there, and thought, in hindsight, it is a great thing, and she probably would have did things differently. But I think the choice at the time with having that tsunami of patients, with COVID versus letting elderly patients go into a care home where we probably thought that was going to be a safer place for them at the time, was a lose-lose choice now that we look back. But at the time, to try and get away from those images of what we were seeing all over the press with people not getting a hospital bed, and we didn't. It didn't come to that, which is a good thing. So I think it is. It's a lose-lose. It's an unfortunate situation to look back and learn more.
Rena, you wanted to come back in. You asked a question.
Yes, thanks very much. I think in terms of the planning, we have known about this since the end of December, at the beginning of January. I know it's not a long time, but what has been clear from the very start, the most vulnerable in the communities is the elderly. And we let people leave hospitals without being tested and put them into care homes. We put them back into their own homes to be cared for by home care workers or by support agencies or by family, and nobody was tested. And so I know there was tough decisions, and I'm not just talking about the Scottish Government, I mean generally right across the UK, you know, and I know we were flooded with pictures of Italy, you know, but maybe if the cameras were in and out the care homes, we would be flooded with as many pictures of people dying in care homes horrendously. I just think it's, you know, it's there's no winners in this, and I know it's been difficult, and I know that, you know, the whole thing's new to us. So I just think they're the most vulnerable, and they are always, I feel, the first to be forgotten. You know, we clap and we applaud Captain Tom, and many of his generation have just been left to die in the care homes, and I just think it's outrageous. And I think just the other thing, Fiona, to say is I've listened tonight, and every time the Conservative member speaks, all I hear is, well, you know, we can't compare ourselves to other countries. Let's put the Dominic Raab to bed. Let's not talk about anything that has shown us up to be, you know, the unorganised or, you know, party that we are.
Well, Helen, I'll give you a chance to respond to that in a minute. But, John, just coming in terms of... thank you, Rena, for that. I'm not trying to cut you off there. In terms of what Rena's saying, in terms of what Alex is saying as well, Nicola Sturgeon is saying, you know, with hindsight, which, of course, is a wonderful thing, I might have done things differently. When it comes to care homes, specifically asking you, what would you have done differently?
I think the circumstances that have been narrated by all three of the colleagues that have spoken, I can't really disagree with their analysis. At the time that COVID was coming towards us, we realised and we thought the best thing to do was to ensure that older people who were being accommodated in hospitals where there was no clinical need for them to be there would be better protected if they were in care homes, because if there was an influx of COVID cases into hospitals where vulnerable elderly people were, the danger of cross-infection was very high. So the judgment was if it was safe to do so, if the risk assessment was undertaken, those individuals could be accommodated either at home with support or in a care home. And there's been constant political pressure on us to reduce delayed discharges in hospitals, to get older people out of hospitals and into care home situations. So we followed that approach. But of course, we have discovered that just how brutal COVID is to older members of our society and our community. So,
but surely yes, we knew, John, sorry to interrupt, but surely we could see from the examples happening in other countries quite how brutal coronavirus was to the older generation. That evidence was already there.
Yes, but my point is that we judged that the best and safest way to support those individuals was in a care home setting or at home with support, rather than in a hospital setting, which would be the epicentre of handling coronavirus cases.
OK, well, let me just turn to Layla for a moment, because hearing what Alex Massie was saying, what John's saying, I mean, there were other countries before us grappling with this, and they admitted people from hospitals back into care homes. But in some cases, in some countries, they put them into quarantine, special places, or quarantine within care homes. Is there anything we could have learned from that reasonably, or is Alex right that actually, you know, this was the best we could have done in the circumstances?
It's incredibly hard to say. I look at all what other countries have done, and as you say, there's been some sort of quarantine centres or interim places to go. It's not exactly clear. I mean, obviously, what has happened with COVID-19 in care homes has been an absolute tragedy. But the reasons for that are not quite as clear-cut as sometimes people are assuming. So we hear people say, oh, it's because everyone was sent out of hospital. But actually, when you look at the data, it's not totally clear that that was something that has created this challenge. And in fact...
Or you think it might have spread in care homes anyway?
Well, that's the thing. I mean, at the end of the day, we don't know when this first started circulating. It looks as though when you started testing has a real impact on this, looking at other countries and care homes. It looks like people going in and out of care homes, potentially, of course, playing its role. And while we really, really want an answer to that, it's too early to figure out what's going on, but we can see that we need an answer and we need to learn. And I guess that what I'd say is that it really exposes the underinvestment and the undervaluing of social care for successive governments. And what we really need here is a bit of a long-term plan. We've seen what's going on in social care, and it's really great that the government is now giving some money towards social care to say, goodness, we need to bolster, for example, your infection control mechanisms. Our members have been telling us for ages that while hospitals have started to get PPE in, care homes have been in a much worse position for that. There's a lot of disparity here. So there's now funding so that care homes are able to get better infection control processes in place and things like that. But that's a short-term fix. And when we look at this, we think, goodness, the moment is here for social care reform. And what are we going to do about it? What's the government going to do about it? Ian?
Well, I think the chronic underfunding of social care across the United Kingdom and in Scotland, the chickens are now coming home to roost.
And this is also a problem under a Labour government
It's been
as well.
a problem for a long time, and we need some kind of political consensus to fund social care. We've been talking about this now for too long, but let's go through what we already knew. We knew that the prevalence of this disease was in older people. It was much more severe in older people. We knew from the 2014 report and task force for social care that there was 34 recommendations. Very few of them were implemented in Scotland. We knew in 2015 that the Scottish Government had said they would eradicate bed blocking. It wasn't done. We knew from the Silver Swan report there was a problem with PPE and a problem with testing if we had a global pandemic. All of that has since happened, and the decision was made by the Scottish Government to move 912 elderly people from hospital to care homes. Now, that in itself is a big decision, and it's a decision I completely agree with John. These big decisions have to be made. But the key thing here was that we're taking from hospital to care homes without testing. So we're essentially exporting the disease on the people that it affects the most into care homes.
We have just heard Layla say we can't be sure that was the critical deciding factor in terms of the exponential growth of coronavirus in care homes.
46% of all coronavirus deaths in Scotland have been in our care homes. This is the epicentre of coronavirus, and that's why, because we sent people there without testing, we sent people there without the lack of PPE, and the figures are, Fiona, you looked at them earlier, Scotland does have one of the worst testing rates in the world, and the biggest problem with that is trying to get testing into the social care sector. We're only doing between 4,000 and 6,000 a day, so how can we possibly protect the residents and the staff in care homes without fundamentally testing them regularly and making sure that they are safe?
Helen, let me just bring you back to Rena's original question, which is, was the policy a planned arrangement, putting patients in care homes from hospitals who hadn't been tested, and does it highlight the lack of value and respect we place on elderly citizens?
So every step of the way, the government followed scientific guidance on what to do and clinical guidance. And
well, there was also, there was also government guidance. So on April the 2nd, the UK government guidance was negative tests are not required for asymptomatic elderly patients prior to transfers into care home. That was government advice.
But our government guidance was informed by the science and by the scientific guidance. But what has happened over time is, of course, that we have learnt. So, for instance, we've learnt and the world has learnt that actually we have a situation with people who may be asymptomatic carriers of the virus, and it's particularly hard, we now know, with older people who don't display the most common set of symptoms. So there's a particular reason, which is why we're now doing testing of all staff and all residents in care homes for older people, those with dementia, exactly to do that, to pick up those who may be asymptomatic as well as those who have symptoms, because we're learning. But I mean, just to go back and to pick up on some of the comments from the audience, and some really, really thoughtful comments. But one thing I will say is that I became the Care Minister on the 14th of February, and since then, I mean, so much of my time and so many people in government has been on how we can support social care, both care homes and home care, through the pandemic. And we know it's really hard. One of the things that we saw early on was looking at Spain and a situation where the army went into care homes where they'd been abandoned and people had just been left and left to die, even from neglect. So we're put in place a whole new reporting system so we know what's going on in care homes, so we get a picture of where there might be risks of that. I should also say, and I know this, I talk so much to care homes, that we should recognise that in England, over 60% of care homes have not had a COVID outbreak. So actually lots of care homes have managed to do an amazing job in keeping COVID out of their care homes, and many of those who've had it have now recovered from that outbreaks, and things are getting better.
John Swinney, you wanted to come in after Ian. We were almost out of time, so briefly, I just want to let you have another word.
I think the point I wanted to make was that in Ian's last answer, he talked about the need for there to be measures to tackle delayed discharges, and then when the government tackles the issue of delayed discharge, we get criticised for it by Ian Murray. There are really difficult decisions that have had to be taken here with the best interests of the population at heart, tough decisions in tough circumstances. And many of the measures we've taken have supported care homes to make sure that individuals have had the resources and the equipment and the assistance in place to make sure they were kept safe in very difficult circumstances.
OK, I'm afraid, Ian, I know you want to come back in, but our hour is up.